session is going to focus specifically on what's been happening, particularly in the last couple of months in China, that I'm sure a lot of you heard about. I'm just going to see if I can share my screen here with you all. Yeah, so the first thing I want to say, I don't want to start on a negative note, but I suspect this may actually be the last ever webinar by the Global Platform. This has been operating since the very start of the pandemic, a kind of spontaneous response by academics and other experts to what was happening, and attempting to share information very quickly via webinars and blogs and other ways. And to some degree, I think now, as we're getting into the middle of 2022, this is an activity. The pandemic maybe is not completely over yet, we shouldn't be complacent, but it feels to some degree as if this is a network that has run its course. And I don't think it's something that we necessarily want to keep going indefinitely. And before we focus very specifically on China, I just want to, and I think this is relevant to some of the things we'll talk about today, is just to reflect a little bit on what we've been trying to do in the Global Platform. And as the pandemic has evolved, as the situation has changed over the last 2.5 years, we've focused on a range of different issues. And certainly over the last year and a half, really, one of our main focuses has been on vaccination, understandably. And we've published a lot of reports and blogs raising concerns about the degree to which older people were equitably, however we mean equitably, included in vaccination programs, taking into account that they, of course, face particularly high levels of risk of mortality if they are infected with COVID. And as you can see here, we've written about lots of different countries. We haven't written about vaccination in China, but many other countries in the world. At the same time, another issue that we focused on right through the pandemic really was a concern that it was very hard to know what was really going on. And in some cases, particularly in countries like perhaps India and in Mexico, that was because the data simply weren't being collected and had never really been collected, and data on the health of older people and mortality of older people were very, very poor. And the pandemic really, brought that out. And in other cases, it was clear that there was political reluctance to share data transparently, particularly on older people and coronavirus. So as you can see here again, we've engaged often quite critically and aggressively with these issues. And finally, I think one of the other interesting things about this group is inevitably as well, as the geographical focus of the pandemic has kind of shifted over time. So we've been interested in the Global South. Latin America was the first part of the Global South to see very high rates of infection and death. But then last year, the focus shifted somewhat towards certain parts of Asia, particularly South Asia. And now, just in the last few months, the focus seems to have shifted towards East Asia, in many ways for the first time. We mustn't lose sight of the fact that other parts of the world are still affected by COVID, particularly the USA. But it would now seem that China and some of the parts of the world around China are the epicenter of global concern. And so on one of our most recent blogs, which I co-authored with Francesca, one of our panelists today, starts, the title of that blog is "Now It's China's Turn," indicating that perhaps the experiences we've seen in other parts of the world were going to be visited upon China. Of course, China is a very different country, and we're now at a very different stage in the global trajectory of the pandemic and in access to vaccinations and policy responses. But particularly, I think in early April, there was a real concern reflecting what had happened in Hong Kong and was starting to emerge in cities like Shanghai, that things could get bad very quickly in China. One of the interesting things is that perhaps that concern is less acute 5 weeks later than it was when we published this blog. And perhaps the rather doom-laden message of this blog has not borne out. And one of the things that would be very interesting to ask our panelists about today is their take on what the situation is in China. Now we're in the last week of May. This is a very fast-moving situation, and always within the global platform, we try to keep abreast of things as best we can. But just to link what I was saying about the global platform more specifically to what I've been able to find out about almost entirely through the Western media, and I'm not going to pretend that the Western media is an entirely unbiased reporter of what goes on in China, but nonetheless, it is widely recognized, both inside and outside China, that older people at the various oldest ages, have less vaccination coverage than people at younger ages. And this was an article that came out in the semi-academic journal in April, making the point that the vast majority of people over the age of 80 had not received their third dose. I think that's relevant because we're now talking about a third dose. This time last year, we'd have been talking about what proportion of older people had had any dose whatsoever of vaccine. And what I found very interesting as well in this article in Foreign Policy was something that was seen around the world, and I think has a lot to do with ageism in vaccination development, that for all kinds of complex reasons, older people were not included in trials of Sinopharm and Sinovac. And as was also the case in parts of the European Union initially, and in the Philippines and Indonesia, it was said because there weren't data on the safety and efficacy of the vaccines on people over the age of 60 or over whatever age, that it was not possible to ethically include them in vaccination programs. And this point has been made about China as well. As I've already said, I think one has to be slightly guarded about what the Western media says about COVID in China. And certainly in mid-April, when people were getting very worried about Shanghai, the claim was made by the BBC and others that there was a systematic underreporting of deaths that should be attributed to coronavirus, particularly among older people in hospitals. All I would say about that is that it would seem that, you know, whatever source of information you want to use, there have not been very many deaths from COVID over the last month. And of course, that's partly because we're not talking about lots of people having no vaccine. We're talking about whether people have got their third or even their fourth dose of vaccine. So in a way, I'm going back to what I just said, I'm very interested to get a kind of update from our two panelists about whether they feel the storm has passed in China, or whether that would be a very premature analysis of an unpredictable and fast-changing situation. So that's what I'm hoping we're going to be able to achieve, at least to some extent today. The way these sessions work, for those of you who haven't been in them before, is that they're fairly informal. We are going to invite our two panelists, Zari and Francesca, each to talk for about 15 or 20 minutes, and I think they're going to share their own PowerPoint slides. As is usually the case in Zoom webinars, you've got a chat function and a question and answer function, and rather than, I don't know, interrupt people as they're talking, if you can put your questions or your comments or anything you want to share in those, we will keep an eye on that. And once the two panelists have finished saying what they've got to say, we should have some time towards the end of the webinar for some kind of moderated discussion. And I will certainly draw on what's been put in the chat and the Q&A there, but I will also open it up to more general discussion. So hopefully, you know, I think we're all old hands at sort of these sorts of virtual meetings, and everybody hopefully will be okay with that. But if you do have any questions about housekeeping and management of the session, please do let me know. To remind everybody, this session is being recorded, but will not be live streamed or shared beyond this group until the panelists have approved afterwards that they're okay with this going out into a wider public domain. So without further ado, it's a tremendous pleasure to introduce our two panelists. The first of them is Zari Liu from Peking University Institute of Mental Health. And Zari and I first met each other and knew each other when we were part, about 10 years ago, or even more now, of an international research project run by the 1066 Dementia Research Group, led by Martin Prince in King's University in London. And Zari is a leading expert on dementia and older people in China. I'll introduce Francesca now as well, just to give you a sense, and then I'll hand over to Zari. Francesca, I discovered Francesca when I was in April, noticing that things were kicking off, as it were, in China, and I started Googling around to see what I could find. And I found this very interesting and well-written and thoughtful newspaper article in the Hong Kong Free Press about what had been occurring in Hong Kong. And then I noticed that it had been written by somebody who was actually doing a PhD in my academic department. And I was very pleased. And so I thought, well, this is somebody it'd be nice to have further discussions with. And Francesca and I co-authored the blog that I showed you early on in this session about now it's China's turn, or is it? So it's fantastic to have these two people, one of whom I've only known, despite being a colleague of mine in Dev, for about a month, and the other one I've known for many years. So I'm going to hand over the mic and the control of PowerPoints, etc., to Zari. And Zari, the floor is yours.
Okay, thank you. Thank you, Peter. And hi, Francesca. It's my first time to meet. Nice to see you here. It's my great honor to be invited to this webinar. And I would like to share my slides first. Let me do that first. Okay. Does that work? Does it work? Let me see. Okay.
Yeah, it's good.
Great, great. Okay. I just would like to share some of my opinions about the older persons COVID-19. As Peter mentioned that I have been involved to the 1066 project for nearly 20 years. Actually, with Professor Martin Prince's help, we did many research in the developing countries, including China. So I have some, I can't say rich, but I have several experience about the older person's health. Especially in the past, I will focus on persons with dementia and their carers. Today, this topic I think is quite great, and also it's very important. And I think this is my question, as also my topic, how to provide care for older persons during the COVID-19. I think this is very important. And also, this is quite difficult to resolve. Currently, I can't provide a full solution for that, but I would like to share my opinion on it. Okay, here's a quick look of the maps of China. And you can see we have many cases. Currently, we have cases nearly 2 million. However, the majority cases actually comes from Taiwan, and in mainland China, this is the figure I updated this morning, about 3,000 cases, and the new cases in mainland China is only 80. The figure is now quite low compared to about 2 months ago, as Peter mentioned in Shanghai. I think you all heard about the news from Shanghai. And this is the current cases by date. And you can see from now about a month, there's a very increase, there's an increase about the figures. However, compared with other countries, the infection rate is not quite high in China. And also the mortality rate is quite low. And you can see this is the figures. I don't think, because I think the median about the BBC definitely misunderstand some figures, I guess. So I don't think we have some weak vaccine ageism or something like you said, the older person died from COVID-19, but the government did not report it that. I don't think so, because in that website, I copied the figures from every province. If they have the deaths because of COVID-19, they will have the reported figures on the website. And everyone who are interested can check with the website I put here. And we can see here, because Peter just now mentioned that we have a quite increased numbers in March and April. You can see that's quite the truth. Here we are about in March, nearly 40,000. And this is the figure in April, more than 60,000. It's a huge increase. But now currently in May, it seems fine. It's much better than last 2 months. Okay, before I talk about how to provide care for older persons, I would like to firstly talk about the reasons why we need to think about this question. So why the older persons, they need special care during the COVID-19 epidemic? According to our plan, because we have a kind of protocol called the diagnosis and the treatment protocol for novel COVID pneumonia. And in this protocol, it is clearly said patients aged 60 years and over need to be transferred to a designated hospital. This is because they are actually high risk to be severe or critical ill patients. So all the patients, if they aged them over aged 60 and over, they need to send to a hospital. And so we can think about that. Do we have some enough capacity to transfer the older persons during the outbreak? Maybe you see some news from Shanghai, because there is suddenly a huge increase of the number of the cases, especially for the older persons. So when the older person, because according to the protocol, all the person need to be transferred to the hospital, but do we have sufficient capacity to transfer the older persons? That's a question. I do not have answer because I do not have the research evidence, but this is my question for that. And so from some news, I heard that some older persons in Shanghai, they do not have enough capacity to transfer the old persons. So before they can transfer to a hospital, they need to stay in a temporary places. So in the temporary places, any special help for disabled or dementia patients? That is also my question, because we need to think about that. In the temporary places, we call it a temporary, it is not a formal places. Usually there is no family caregivers accompanied with older persons. So how we can provide care? Maybe some volunteers, they can do provide help. But do the volunteers well trained before? Do they know how to help for the activity of daily life for the older persons, such as help them to eating, toileting, grooming? And can they communicate with the person who, if they have dementia? Do they have the sufficient manpower? I mean, the volunteer, maybe much less than older person, they need help. So how to resolve the situation? And also I heard from some news, also from Shanghai, in some temporary places, they only provided a squat toilet. As you can imagine that if a person is disabled person, older person, they have difficulty to use the squat toilet, they need seated toilet. If there's no seated toilet, how can they do? And also I heard some old person, they have sit down the chair because the bed is not too comfortable, like a temporary, like a camp bed. So do they have some nursing bed to help the older persons to get up? We do not know. And also we need to think about that. In the temporary places, do we need to provide them? And how many such kind of special facilities they need to prepare for older persons with stable and dementia patients? That is all the questions. And also the similar situation actually in the centralized isolation places also have the same thing, because we know the Chinese, we actually use the dynamic zero strategy. And in some point, if the person have close contact, they need to stay in the centralized isolation places. In such kind of places, any help for them if they are disabled or dementia, we need to think about that. Okay, so when the city is on lockdown and there's also some problems, the first thing is food. Do the older person has stored enough food at home? And the young person, maybe they heard about the lockdown, so they can go to the supermarket, buy many things. Maybe the older person, they do not know, so they stay at home, and suddenly the city is unlocked. So if they prepare food, enough food at home, that's fine. But if not, what shall they do? And also in China now, currently, many young people and old age person, many young people and mid-age persons, they usually buy food from the internet using a mobile phone. There's many apps can do that. But for the older person, they might have difficulty to use the mobile phone. So they do not know how to buy food from the internet. So when the lockdown, you still can buy some food from the internet, and some special person, deliver person, they will send to you. However, if they do not know how to use the mobile phone, what can they do? And also, some Chinese people, we like rice and noodles. That's quite easy to store. But this is not the case or not suitable for the patients such as with diabetes. And so they need to eat many vegetables, fresh vegetables, but in lockdown, if they lack of food, what shall they do? And because we know the vegetables cannot store for a long time. And also in Chinese culture, some old person, they are quite shy to ask for help. Like I saw a news said an old lady, 90 years old, and eat one cabbage for a week because she thinks that the staffs in this community, they are quite busy for other things. And so she is quite shy to ask for help. So that's kind of things, kind of a traditional Chinese culture, especially for older person. They do not want to bother other persons. So they have fewer help-seeking behaviors. So if they do not let us know they have difficulty, how can we help them? Okay, so this is for food. Another important thing for older persons definitely is medicine. During the lockdown, some pharmacy, they are closed. So you cannot buy medicine from the pharmacy, and they cannot deliver to you. And also sometimes it's kind of delivery system is also sometimes it's not as usual. It also have some difficulties to deliver it. And in some cases, we know in China, some hospital, they provide remote medical services, which means a doctor from the internet face-to-face, not real face-to-face, but from the screen, you can see doctor and you can tell the doctor your problem, and the doctor give you some suggestion, something like that. But you need to know how to use the internet. Like today, our audience can participate in this webinar because you know how to use the internet, how to use the computer. But for the older persons, if they do not know how to use that, so what shall they do? And we can still think about the medical services. They have limited accessibility, especially during the lockdown. So for the regular visit, maybe it's quite difficult. But in some places, like in Beijing, I know in some area in April was on lockdown, and the taxi company actually they assigned some taxi around, so they can transfer some person if they need to go to the hospital. However, this is a kind of point-to-point transfer, which means as a driver, I only take one older person or their family members and go to the hospital and then send them back. And after that, you need to do, or they need to do the disinfect to stop the the transmitted of the COVID-19. However, if they are in the outbreak, do they have enough taxi around? And also the similar thing as for the emergency. If the person has some emergency problem, they can call the ambulance to come. But do they have enough ambulance if suddenly many people, many older person, they need to help? So only how many? I mean, the number of ambulance, how to access, how to predict. I mean, this is all very difficult. So this is all the questions we need to think about. I do not have the answer, but I just think about that. If they have the problem, what shall I do? What shall we do? Okay, the next thing is during the lockdown, definitely social isolation for the older persons, especially for those persons, we call it empty nesters, which means the older persons living alone and their family members, especially their children, lives very far away from them, maybe in the city, very far, or maybe abroad in other countries. So they called empty nesters. So who can help them? They lack of family support system because their family members are not around them. And also the lack of social support systems because on lockdown, many things we cannot do. And for the older persons, they might have limited access to the information because they might lack of the knowledge to use the internet. They do not know the news. They maybe see some news, but very short times. And some quick happen things they do not know, because usually we always see my mobile phone to see the news, but they do not know how to how to use that. So that's a kind of problem for them. And when they restricted at home, they will have fewer physical activities. They will feel quite lonely, and also maybe they have a higher risk of depression or anxiety. And in some cases, if they fall down, I mean, they have some accident at home, it's quite difficult to be found. I mean, to be like other person to know this. So they have such kind of problem. And that is for the city when the city or the areas is on lockdown. During the time when the city is not on lockdown, still have some problems. Especially, I mentioned this a lot of time that I said, and the older person, they have limited knowledge of using smartphones. So they will have difficulties to do the nucleic acid test. Because now, currently in China, when we want to do the nucleic acid test, you need to have a smartphone and you need to scan a barcode, and then they know your information. So if they do not know how to use the smartphone, so they have the difficulties on that. And also in some places, I mean, currently now is fine, but about 1 month ago, if we want to do a nucleic acid test, we need to make an appointment using the mobile phone, by the mobile phone. You can only by the mobile phone, you can make an appointment. Or you can go to the hospital, but maybe there were many persons around, and the older person, usually, you know, they are worried about to have the infection, so they do not want to go out, especially to crowded places. And also when we go to shopping areas or to a supermarket, we need to show a called health code for checking. This is a kind of simply also similar things. It's like you scan a barcode and there was a code to show if you are fine. I mean, you do not have any problem. I mean, you have the negative results of nucleic acid test and other things. You do not visit some high-risk areas, etc. And so if they do not know, that will have the difficulties for that. But still have the difficulties. I do not say they cannot go. Because in some shops, they provide another way is you do not have the house code. So you need to write down your information, your ID numbers and your telephone numbers, your contact numbers, your names, something like that, for help the CDC to do some tracking if needed. And also, if the older person do not know to use the smartphone, it is difficult to make an appointment to see a doctor, because now when you want to see the doctor, you need to make an appointment. So that is also difficult. But you still can go to the hospital, because I know in our hospital there is a special registration places for older persons aged 60, which means you do not need to make appointment if you are older than 60. You just go to the window and tell the person to register. But in sometimes, maybe many person make the appointment, so there's no capacity for the doctor. So you may need to come tomorrow, something like that. It is not quite convenient for older persons. And also, if you buy food, buy medicine, buy other articles for the daily use, many young person, we use mobile phone to buy from the internet. And so this is all difficult for older persons, especially sometimes for older person, they need some like something like adult diapers, so they can't buy it from the internet. And it's also difficult for them. And even during even this area is okay. I mean, it's not on lockdown. The older persons, they do not have enough outdoor activities, and they have less communications with communities, because originally they can go out for dancing, especially now in Beijing is nearly 8 o'clock. So traditionally many older persons, they go out and dancing with other persons. They're quite happy, but in currently now, even the areas not on lockdown, such kind of activities not hold, because they are afraid to have some other person, who knows who has the problem, the disease. And also they will have fewer visits by family members and the friends, because maybe the friends and family member, they are on lockdown. Okay, so that's the reason about why we need to think about how to provide care for older persons. And now this is something from Shanghai, and I read the news. I think we actually did something, I mean, in Shanghai. So just to share with you, because in Shanghai, there's kind of special hotline to help older persons. This is 24 hours work. And you can see about half months, they have about 5,500 calls for concerns, and they received, and about 500 concerns were resolved. So which kind of concerns from the older persons? Similar things as mentioned before, the lack of food or basic necessities. They have difficulties in online shopping. They have difficulties to buy something like the adult diapers or some other nursing pad. They have difficulties to buy medicine or see doctor. They would like somebody to provide help, such as repairing items or contact the taxi. So in that time period, the Shanghai is still on lock. And so the hotline actually try to provide help. You can see the majority of the concerns has been resolved, how they were resolved. So usually the staff of the hotline, they will coordinate resources with the local communities to try to provide help, like provide food, provide something they need. And they also can organize things they call the community group purchase, which means many persons together, they buy something together and they can deliver to your home. And also they use this program, so-called Older Friend Partnership Program, which means provide care for all persons aged 80 by some healthy volunteers aged 60 years and over. And also they can help to contact the community to send volunteers to help. So this is the situation in Shanghai. So although it's quite recently, because at the first beginning of April, probably they do not react quite immediately, but now recently everything's changed and everything's getting better. And I would
Sorry,
like to,
sorry.
sorry, it's too
Right.
long. Yeah,
Well, could you wrap up in a couple of minutes? And
okay,
then I'm just
sure.
concerned that some people may want to leave the session at
Okay,
1 UK time.
okay,
Okay,
sure,
thanks.
sure. Okay, I will quickly, because the slides is here, maybe you can look at that. So I would like to say something about some special care for older persons in Beijing. And we actually have a guideline for community-based prevention and control for COVID-19, which was released on 11th May. And older persons actually one of the key populations, especially for those persons who live alone, widowed, disabled, demented. And so they actually emphasize the importance of the social workers. So the social workers can contact the old persons by several ways, and they should understand the difficulties of older persons. They should help with the basic medication for those with chronic diseases. They help with going out for the hospital if necessary, and also they will provide some psychological aids for the persons with symptoms of depression or anxiety. And they can coordinate some residents, volunteers, and to provide help. And also for that is for older persons and also for the disabled. And the guidelines said if the person had nobody to take care of the disabled old persons, the social workers should contact the local civil affairs relations to provide some temporary resettlement. And also the social workers should contact the primary health center to provide some medicine or from medical help. And the social workers can provide some online rehabilitation services and also some support for family caregivers. And here's something about now the older persons living in Beijing. And we can see in community, some healthy older person can be volunteers to help others. And the family doctors, they are living inside the community, also can provide help. And about the vaccination, we can see the increasement about that.
Sorry, one
Yes,
more minute. Sorry.
yeah, okay. For the elderly persons at home, they are fine. And also we have an elderly social care center can provide help for older persons. That's my last slide. Okay, so how to provide the care for older persons? I think we should do together from the individual level, family level, and the social societal level. We need to think about the prevention and the control of the disease. We need to try to provide medical service, and also we need to try our best to provide social support, and then we can provide care for older persons. Okay, but we need to think about during the outbreak. Maybe the things will be much different. We need to think more. Okay, thank you very much. Thank you, Peter. I'm sorry, this was
No,
too
not
long.
at all. It's a great talk, and I
Yeah,
wish I'd scheduled more time for the webinar now because
no,
there's
no.
so much in there.
Yeah,
Without further ado, I'm going to hand over. If you can stop screen sharing, I will hand
okay,
over
sure.
the microphone to Francesca, who she's got a difficult job now because you said some really interesting things. I've said some things about China, and now she needs to kind of fit her own talk around what's already been said. But I'm sure she can add some real value to the session. So over to you, Francesca.
Thank you, Peter, and thank you, Dr. Liu, for this very detailed presentation. I was actually just, listening to your whole presentation about the situation of elderly care and COVID in China, especially when you talk about the situation in Beijing and Shanghai, and that is, in certain ways, they're very similar, if the situation here in Hong Kong and other city, but there are also like fundamental differences. But today for my talk, I don't have a PowerPoint to share. I'm actually only sharing my kind of personal experience and stories and as a primary carer for elderly person and during this whole pandemic. So thank you, Peter, for giving me this chance to talk about, COVID and the situation in Hong Kong. And But for my expertise and my research, it is actually not related to COVID at all. So I'm doing my PhD in urban changes and spatial politics in Myanmar. So it is a totally different topic, as you can hear. But the reason why I'm kind of writing about Hong Kong and COVID, and I would like to share you my screen here. Can you guys see my screen?
Yeah, we can now.
Okay, great. So 1 second. So as Peter has mentioned, I wrote about this article in a local newspaper about, like talking about why elderly have kind of low vaccination rate in Hong Kong, especially, for those who stay at care home. So I'm writing this article and also another article about, the kind of anti-vax situation in Hong Kong. I wrote it last year. Oh, I just 1 year ago, same date. So like all these, COVID stories and about elderly home. And the reason why I'm writing all this is because of my father. And he passed away on Saturday. So it is, I get involved.
I'm really sorry about that. I'm really
sorry. I didn't say.
I'm sure speaking for everybody in this session, we're really sorry.
Thank you. Yeah, but so I got involved in this topic because caring for my father, and so the situation with my father, would like to share a picture of him. So the situation with my father was that he had Parkinson's disease and also anxiety disorder. So he has stayed in an elderly home in Hong Kong since 2018. And when the pandemic hit, in late 2019 and early 2020, he was basically, isolated in his care home for a very long period of time, because at that time the government didn't allow anybody to visit. So and that was, that started, get me thinking about, going through all the red tapes, trying to understand the situation about elderly care and care home services in Hong Kong, and trying to, get involved in, what are the reasonable policies when we are talking about elderly, when we are talking about, residents staying at care home, what is actually the best care we can get for them. And it is also all this kind of situation, and also later when the government kind of relaxed the policy and saying that, oh, people, if you are vaccinated and you can go visit, and it is and all this process that got me thinking, had more experience, talking to staff at elderly home and trying to understand, their own difficulties as well, because I think in a lot, when we're talking about elderly services or vaccination for the older population, we talk a lot about the elderly or the nurses or the medical care, but but my experience is like there's a lot to do with care home services and the providers and the staff and social workers working there as well. So so my journey about, writing about COVID and trying to understand the situation starts because of my dad. So as would like to share some preliminary data about the COVID situation here in Hong Kong, especially for older generations. So here you can see this is the vaccination rate here in Hong Kong. And I only focus on people who are aged 60 and above. So, sorry. So the vaccination rate has actually improved a lot since I wrote my article a few months ago. So for people who are aged 60 and above, now the vaccination rate is around 82%. It is not, if you compare to, some other countries, it may not be the highest, but it has already been improved a lot because For the start, it was actually a very low rate for elderly in Hong Kong to get a jab. And if we look at the data for care home, so last year, when the government announced, the vaccination rate for residents in care home, it was actually a very low 3%. And we started having vaccination program in early 2021. So within a few months, the rate was extremely low. And this year, when I wrote this article in March, it rose up to 25%. And now in May, the government just announced the latest data for residents in care home. The vaccination rate is now around 84. So it's kind of similar to, the general vaccination rate for elderly here in Hong Kong. So these are the kind of, simple data. It's kind of telling you what the situation is in Hong Kong. And for my, this, I would not call it like a presentation, because I would more see it as like me sharing my story, my story and my dad's story, and trying to ask the questions of, so what went wrong with the Hong Kong's approach to getting the residents at care home to get vaccinated? Because as I said earlier, it was actually extremely low before, but now the rate has picked up because the government has introduce a few new policies, for example, increase the rollout at care homes, and also have more kind of incentive. For example, they if residents, if they want to stay at a care home, then they may have to get a jab, otherwise they may face evictions or what. So that these kind of new measures to push residents at care home to get vaccinated. And for my dad, at first he was 76. So at first he didn't want to get a jab. And for me, it took me a very long time trying to understand him why he didn't want to get a jab. First, I didn't really get a lot of chance to talk to him, because since the pandemic, the Hong Kong government has a very strict policy in terms of who can visit elderly home and when. And for more than 1 year, no one was ever allowed to visit. So I wasn't allowed to see my dad for more than a year, even though we stay in the same city. And for that reason, it was very difficult to even talk to him, even though we can call on phone. But for an older person, it is way more difficult to communicate with them if you're not sitting next to them. Like phone, FaceTime, Skype. My dad didn't quite respond to that. Like his cognitive ability was just unable to cope with, where is the camera? He never really figured out where it was. And it was so difficult to talk to him about vaccination, about the side effects, why he wasn't willing to get a jab. So for a whole year, it was basically impossible to talk to him about, why he didn't want to get one. And then later, late last year, the government started to allow visits again, I think starting from May. Yeah, so, if you want to visit an elderly home, then you need to prove that you are COVID-free, and then you can register with the care home and to get a visit. So for the care home that my dad stayed, they only have around 56 visiting slots in 1 week. So it means only 56 residents get a chance to see their family member. And that care home that my dad stayed, there were over 200 residents. So you can see, there's it's very difficult and competitive just to get to see your loved one at a care home. So there were times that I was just unable to see my dad for weeks because I was just too late. And And each time there's only one person who can visit, and you cannot touch the resident, and you cannot meet the resident for more than 15 minutes. And there was also no privacy. I was only able to see Dad at basically right next to the entrance door, where everybody, the receptionist, the nurses, the social workers, visitors, they're all, walking around, and you were just sitting in the middle of it, trying to talk to, my father. So for that time, it was very difficult to get, face-to-face communication and trying to understand why vaccination was a problem to my dad, that he was unwilling to get it. And then later, I was, starting to talk to nurses and also staff at the care home, and try and get a sense that there was a huge anti-vax atmosphere at the care home. So I was talking to social workers there, and then they were like, they didn't really encourage the residents to get a jab because they were kind of worried, like, what if there were any side effects? What if they die? And then that would have problems with the care home. And even like the staff there, they had this kind of anti-vax attitude that they themselves didn't want to get a jab either. So why would they recommend some, residents to get one? So that is this problem that, the whole atmosphere at a care home was very anti-vax. And because, other residents and the social workers and the nurses there, they are basically the primary, groups of people my dad had contact at that time, because as relatives and family members, we couldn't visit. So it was actually very difficult to counter that anti-vax atmosphere at that time. And it happened to different other residents as well, as I talked to other family members while, trying to understand what was really going on in care homes. So for a long time, like care home wasn't particularly encouraging, for the residents there to get a jab. And also for a long time, the government didn't really provide any rollouts. So if anyone want to get a jab, and in Hong Kong, we have two kinds. So we have the Sinovac from China, and we also have Pfizer. So, and anytime if you want to get a jab for the residents, you have to book them at a like an outside community center to get a vaccination, to get a jab, and it was actually quite difficult as well. So getting a jab was challenging, and at the end, my dad finally agreed to get a jab this year in March, because he heard that like if you don't get a jab, then you might be evicted, and that was the pure fear. He wasn't worried about his own health, but he was kind of incentivized by something else about being the possible eviction that arranged him to get a Pfizer at that time. So it was like during this a year and a half, almost 2 years journey with my dad at a care home and the whole whole service that got me wrote this article in a local newspaper to talk about, like why older people, they are not really getting vaccinated, and especially for residents at care home, and what we could do about the situation. So, to briefly give, some of my observations, I would say, the approach that we take in terms of, trying to encourage older people to get vaccinated, it is the approach that we took in Hong Kong wasn't trying to answer the older people's concern. They didn't really provide the kind of right message or motivation to the older people. So for a very long time in Hong Kong, the government is basically saying, if you get a jab, then you won't die. So that was the message. But I would say for at least for my dad or for other elderly or older residents at care home that I got to know or from their relatives, you know, this kind of message, you know, like you're not going to die if you get a jab, or you're not, or this kind of, or if you get a jab, then the economy will be better, is not really motivating. Because even if you get a jab and you stay at a care home, you are still not allowed to go out. My dad was basically locked in the care home for 2 years. He was only allowed to go out when he was sent to the ER or sent to a clinic for a regular checkup. And there were times that like I wasn't even allowed to see him, and the only place I met him was at a ER while I was like staying at the ER with him while he was admitted to a hospital. So, you know, there were definitely not enough incentive to encourage the residents to get a jab. And there were other measures. For example, when I said earlier, the government trying to say if you don't get a jab, then you might be evicted from the care home, and that did provide certain incentive, but it always came too late, because, you know, the residents would only do it at the very last minute if they realize that, oh, they must do it, instead of trying to believe that it is something truly, you know, beneficial to them. So so that is so that is, you know, the kind of reflections that I got from my father's experience. For that, I also have another observation, and then after that, I'll be done with my sharing. Another observation is how in, you know, in Hong Kong, how we understand public health is, you know, as merely a medical issues, but do not have enough care about, you know, taking it as a political or even a personal matter. The idea of, you know, you trying to get more residents or older people to get a jab is kind of like you're trying to discuss it as if they are just data, or they are just, you know, a number. If the number goes up, and then, you know, oh, that means this is great. But I feel like, you know, this kind of understanding the public health as a personal matter is kind of lacking in the policy debate in Hong Kong. That, you know, what is really helping you know, the elderly is locking them up in a care home, not allowing them to see their loved one. Is it really helping the residents there, or is there any other ways that we can encourage the older population to get a jab? Is there any way that, you know, we can do, for example, instead of only approaching the elderly or the residents, or is there anything that we can do with the care home staff? Because if they are anti-vax, then, you know, is there something that we can do to provide them? For example, as I said in my in the article, is there more medical services, medical checkup that we can provide to care home staff? Because one of the concerns that I got from them is they are very worried about side effects of the vaccine. They're kind of worried they're too new, so it's unclear how safe they are. But if they get, you know, like a health checkup at hospitals or clinics, that may actually, you know, kind of answer some of their concern. And these are the, you know, different policies that I think it is important to ask in this situation, because even though it seems like in a lot of the world, especially maybe in the West, COVID seems like it's not as current or as emergent as, you know, it used to be. But in other parts of the world, like China and Hong Kong, it's still going on, because we have this COVID dynamic zero COVID policy. So lockdowns and quarantines and isolation is still part of our daily life. So these are the questions that that I'm trying to ask and trying to answer, and would like to hear more, about your thoughts about the situation in China and what can be done. Thank you.
Thank you so much, Francesca. And again, condolences. When you agreed to give this talk for the original date, your father was still alive. So, clearly a lot's been going on, and we just hugely appreciate the fact that felt you were able to give this talk about something that's been incredibly upsetting and raw for you. I won't say any more because we don't have a lot of time, and these two talks are very different, but I think they complement each other so well. And I know Zari has her own personal experiences as well, but I think a really good contrast between a kind of very general view of what needs to be done in the context of China and older people in the pandemic, and then this, very, very personal, focused, but very thoughtful and intellectually engaged discussion of particularly what's been going on in Hong Kong. So what I would do is just invite people, participants, because I don't want to monopolize the discussion, to raise their hands, and then I will unmute their microphones. But perhaps while I'm waiting for any hands to go up, I would just invite Zari, perhaps, if she wants to comment, if Francesca's talk is provoking any immediate responses from Zari as well.
Sure, Peter. And I totally understand Francesca's own experiences about, I think, the two main things I would like to comment. The first is about the vaccine for among the older persons, especially, at the beginning stage of the COVID-19 in Beijing, in Shanghai, and other cities in mainland China, the older persons, they are refused to have the vaccine because they actually lack of the knowledge about the vaccine. They are too worried about the side effect, especially they thought they have some cancers, they have some diabetes, hypertension, whatever things like that. They are worried about the vaccine have some severe side effect to them. But now things has been changed. Especially in Beijing, because I know more about things in Beijing, and the government in Beijing, they actually encourage the older person to have the vaccine by providing 10,000 yuan. 1,000 yuan. 1,000 yuan for each person they go to have the first dose for the vaccine.
Tell me how much that is in dollars.
That should be something about, let me see, 150, something like that, US dollar. 150 US dollar for older persons who aged 60 years older. And the government actually pay for that to encourage older person to have the vaccine. So actually now we can see the vaccine rate increase a lot. About 80% of older person, they have the whole course vaccine, and about more than 90% of person, at least they have one dose of the vaccine. And this is the first thing I would like to share, comment. The other thing is about, I totally understand your own experience about you can't visit your father because they are totally restrict lockdown about in the elderly home. And now in Beijing we have the similar policy. That we have very restrict management inside the elderly home, and but I do not, because my father actually living at community and living not far away from me, so I visit them frequently. So probably that's I will feel sorry if I say something not quite good, but my understanding that because my friends, their older person, their family, their parents living in the elderly home, they do not complain too much for me about anything. They saw this kind of protection for the old person, because if one new cases in the elderly home, they increased. So very quick, immediately, maybe almost all the older persons, they will have the problem. So actually, I mean, they had to do that, the policy. But in because I do not say too much, because I originally would say a little bit about the elderly home in Beijing, because I heard from news they provide many activities inside elderly home. They provide a food menu, they change the food menu every week. They organize kind of activity to try to let them feel quite happy. They also can call them family members with WeChat. You can see them face by face. So I mean, maybe they had to do that.
So to interrupt, Zoe, and I think there is a fundamental issue, and I've seen it in my mum's care home as well, which is about this public health. This is basically human rights, and public health versus a wider understanding of the consequences in terms of people's lives and of their families. And it's such a dilemma, and I see it in the UK. I want to, because Camilla has got her hand raised. Camilla Williamson is from HelpAge International, so I'd just like to give her a chance to respond. Sure. Camilla, the mic is yours.
Thank you so much, Peter, and thank you so much for the presentations today, and just so much thoughtful material and reflecting so much what we've seen in so many different contexts. And I think that last point around human rights is just absolutely critical. And I think that it's COVID-19 and in care homes particularly has obviously brought out some of the worst treatment of older people that we see in that passive way that they're treated and haven't been engaged, haven't been seen as participants and being able to shape what happens in their own homes, in care homes, but also with COVID-19 responses more generally. And I think on that point, that's really been seen in vaccination. And it was great to hear Francesca's reflections. Just thank you so much for sharing them. I think that this is really what we're seeing in so many communities in Africa. Just failures to properly engage, communicate about vaccines, build trust, and help people to understand what they're there for, why they're being promoted, because that is obviously the biggest influencer really on vaccine. Obviously access is a big issue, but one of the biggest issues facing vaccination of older people at the moment in some countries in Africa is demand. And we've found HelpAge programs where we've done community dialogues and linking the different service providers with older people and having these open forums where people can ask and understand and also be provided with information have had a massive impact on uptake. And as you were saying, these issues, it's just often ignored and people are given coercive measures to try and get them to uptake, to increase vaccine uptake, and that's just not how this should be done. And it's obviously not working in many contexts. So thank you so much. I also, just in case I don't get another chance, just want to say thank you so much to Peter and to Lucas and to others who've been engaged on these platforms. They've been so important, and the work that you've been doing over the last 2 years has just been critical. So I really wanted to say thank you from me, but also I know from many, many colleagues of mine at HelpAge.
Well, thanks. I just want to follow up. There's a chat comment from Kirti Nakre. Sorry if I've got your name wrong. And if you want to, I've allowed you to unmute your microphone. You've got a question about mental health. Would you like to make that in person, as it were, or do you want me simply to read out your chat?
I mean, I can just ask the question if that's all right.
Super.
Yeah, so I'm based in India, and I just started doing research on assisted care, and I mean, for me, it's in Indian context, it's very, very new, and also mental health is something something at a very nascent stage in India, and especially when it comes to geriatric or the older adults. So, I mean, firstly, I would like to thank both a presenter and to Peter as well, and also my heartfelt condolences to Francesca. But I just want to know, is there support for older adults for mental health? Because I think they're a unique demographic group, because there is a lot more support for children, young. I mean, it's not great in developing, it's not great in India, but there is some. But then more I kind of work with these groups of people, the more I realize that their needs are very unique and very different from maybe the other demographic groups. And also, how does that work in China? Do you have counselors for them? Thank you very much.
May I just add a rider that I think because we don't have much more time, I'm going to give Zoe and Francesca one kind of final closing opportunity to respond to what Camilla's was talking about, what Kirti's just been talking about. And I would just like to throw in one sort of final, very quick point, which is to what extent, I mean, we all know everywhere in the world that the pandemic has really brought out into the open how rubbish our systems of social care and health for very older people are everywhere in the world. And the question is, do you get a sense of, and I think particularly Zauri's talk demonstrated those failings, and you know, it's a global phenomenon. So do you get any sense that there is a genuine process of learning from that, and that post-pandemic things may be improved because of what's happened over the last 2 years? So that's my question. I don't see any other hands up, so I will hand back the microphone first to Francesca and then to Zauri, and then we'll close. Thanks.
Thank you, Peter, and thank you for Camilla and Kurti. Sorry if I pronounce it wrong, for the questions. I mean, the questions about like incentives, human rights, and mental care is extremely important, because I can tell you in the situation in Hong Kong, they don't have any mental health support. That's what I can tell you. Like, my dad has anxiety disorder, and this whole pandemic and being locked down in a care home, it just didn't help him with anything. And another problem is because of the pandemic, he wasn't allowed to go out to see his doctors and had like counseling and services. Everything was done on the phone. So you know, I really appreciate that you mentioned this mental health problem, because I think it's a real issue, and it's not most of the time it's not being addressed too, because you know, when we are looking at data, you're just like keeping them alive, you know, get them, you know, vaccinated, but not really care about what they are really thinking. And that's why I think, you know, it's so bad to just treat them as data and number and not putting a human face to what they really want. So that is a, you know, thank you for asking that question and the concern. And whether I think the situation in Hong Kong, I don't dare to say, you know, much about broader China, because I only live in one city, so I don't dare to say, you know, a national policy. But in Hong Kong, I would not see anything improved even after the pandemic. And, you know, we don't know when it will finish, you know, it will end the pandemic, because it feels like the definition of what a pandemic is, when it starts, when it will end, is basically depend on the government's definition of when they want it to end. So as I consider, you know, Hong Kong government is going to follow, you know, the Beijing government's policy. You know, if we are going to continue to have this dynamic zero policy, zero COVID policy, then the situation will continue. And I won't see any much improvement in Hong Kong, just because I'm not super confident with the elderly service here, or social welfare, and how they say, you know, how they consider social welfare not really as a human right, but rather, you know, like a byproduct of the market. But it's just a situation in Hong Kong. So that's my like answer to that.
Thank you, Francesca. Oh, and I heard a bit of conversation going on in the background, so maybe if we can mute our microphones, other than, of course, Sari, who's now going to provide her final thoughts.
Sure, Peter. Okay, so very quick response for Kurti. Sorry for the pronunciation. And we actually, we are starting to do that, to provide help for the older persons in terms of the mental health problems. As I mentioned in my slides, we had a kind of guideline, and we encourage the social workers to do more things to make the liaison with the older person, to find if they have mental problems such as depression and anxiety. And before, actually, there is no direct help for older persons. But I hope from now we can provide more for them. That's for the very quick first question. And for Peter's, I think it's difficult to answer. Actually, for me, and I think for Francesca, we are not kind of person to answer this quite huge, difficult to answer questions. We do not answer. But my opinion that we can think about the guidelines for the community-based prevention and control for the COVID-19 in Beijing, which I mentioned. It's a quite nice guideline, which is actually new released just half months before, and maybe other cities we can follow that. I don't think it is really works. I mean, because it's only half a month. We need to think about if the guideline is perfect, how we can implement that. If the guideline has a problem, how we can change the guideline. And also, even after the COVID-19, if it ended, we still need to think about if the guidelines is good for the older persons in community in Beijing, other cities in Shanghai, in Hong Kong, because the social worker system is not quite good. I mean, it's not there before inside China. So maybe we can think about new strategy to help the older persons by using the social workers. Okay, that's all.
Well, great. Well, thank you so much. And I think it is important to not sort of have a kind of knee-jerk reaction and say, this is what China has learned, this is what China will do, because I think there's been an element of that kind of discourse in some high-income countries. And it felt last year, perhaps, that there was a little bit more of a window of opportunity where people, political opportunity, especially for people to start thinking a bit more realistically about these issues. And I actually think that window has slammed shut now, and people are on to the next issue. And I just hope that somehow in China, clearly it's a very different country in many ways, that there will be a different process of learning from what's gone on. So that's all I've got to say. And I think we're going out on a high in the global platform, and I'm just hugely grateful to both of our speakers and to everybody who's listened into this session. I will check later with Francesca and Xiaori about whether they're okay with us putting this on our website. I think it'd be a great resource. And I hope to meet you all, maybe Francesca, when you get back to the UK. I assume you're still in Hong Kong, is that right? And Xiaori, our paths must cross again. Maybe next time you're in London, that would be fantastic. So thanks everybody. It's been a super session.